Tara coaches and Tara partners. There is so much going on out there, from Facebook ads that can get you GLP-1 meds by tomorrow to digital programs that every week promising employers to control their healthcare costs. So I wanted to break down the Tara mission behind GLP-1 support programs. We have been operating hours for over a year now with our partnered primary care physicians just to simply help the patients. And now that they have been thrusted into the headlines, we want to take a step back and explain our vision, how we structure it, which has not swayed, but only grown stronger. Tara is a lifestyle medicine coaching company that contracts with physicians all over the country to support their patients. We have been associated with the American College of Lifestyle Medicine for years. We have MDs on our coaching roster. Most of our coaches are nationally board certified, and we represent multiple languages and ethnic backgrounds. All of those qualities have attracted the attention of employers and plan admins now that groups are scrambling to figure out how to handle these new weight loss meds. So what are the things that matter in a weight loss journey that include GLP-1 medications? Because not all journeys include them. To us, there is no dependency on this medication. We do not rely on them. We simply view them as a tool in our client's tool belt. And not everyone needs that tool. It depends what you're building and where you're starting from. Obesity and overweight. It is a disease riddled across our current population. We all agree there. But we may differ by saying it is a disease of our modern environment. Yes, some genes may play a role, but so does zip codes, street corners, school system, TV channels, grocery stores. That is where we act. That is where Tara thrives with our clients. GLP-1 medications. And some may get angry with my simple interpretation here, but they are a lifestyle medication. These meds trigger hormone responses in our body to slow down digestion and shut down food cravings. It is a tool or maybe even a weapon to fight the manipulative food and media companies that we battle every day, telling us to buy more, buy this, sugar, sweet, juicy, fat, supersize. It's become so bad that it's not even just the food companies we buy from, it's the ingredient companies with food policy dollars that influence how food can be made and what food is in our schools. We don't have a choice. They can spend their big dollars to cheat with prime commercial times or eye-level shelves at the grocery store, even biased research studies. So why can't we use a tool to silence them? Even the playing field a little bit, make it a fair fight. After all, it is harming us. Who here has ever tried to build a big sand wall at the beach and fight the waves? If you build that sand wall during high tide, you'll never make any progress. Every wave will just keep knocking it down. But if you spend a little time analyzing how far the waves are coming up, where the dry, hot sand is, where the real power waves hit, then you wait until low tide. Low tide is our GLP-1 medication time period. It gives you a window of time when the waves can't knock down your progress. It gives you a window to gain confidence, call in others around you to help build your wall. Now, when you build that wall, it feels giant. That's your fortress. Now, when you begin to come off your medication, high tide's coming back, access to those temptations are coming back, waves begin to hit your wall. You cheer when the wall defends it. Some big ones come. Think of wedding weekends or holidays. All the temptations and pressures around it. It does some damage, but your wall holds. This is the same scenario in our GLP-1 time frame. We use that window to build a fortress so it holds and it stays with us. But we must also talk about side effects. Yes, they come with side effects, and yes, we will continue to discover more and more side effects. Some are worse than others. So why not fight that as well by maybe not sprinting to a high dose and only using it for a short term? Why is that not an easy solution to talk about to the nasty side effects? Slow the rush. So here are Tara's 7 laws of the GLP-1 universe. 1, safety, outcomes, cost. Safety, outcomes, cost will always be our hierarchy of importance. That order does not change. After all, the FDA's approval, they recommend that these medications are used with diet and lifestyle modifications. It says right there in black and white. It is a doctor's and an employer's fiduciary duty to keep a patient or employee safe. So docs, if you have touch points on your patients for every meal and every social pressure, then all the power to you. If not, we can help. As your health coach pharmacy, we'll get you a coach that will help. And employers, If you want to reap the cost benefits of that 20% weight loss on your claims list, it pays back dividends to do it responsibly and slowly in this scenario. 2, medically eligible does not mean personally eligible. A patient can be medically eligible for a medication, but a single visit is simply not enough to determine if they are personally eligible, mentally ready, if they even really need it. We spend a full month of education and support with the patient before medications are determined part of this person's journey, and we do so in coordination with their doctor, so it's all set up right. 3, why the rush? Science shows us that safety requires a slow ramp due to the side effects. Science shows us that there's a better chance of long-term positive outcomes with a slower and steady ramp to avoid the roller coaster, weight loss and weight gain. And costs are better controlled with a slow ramp because it allows the patient to keep lifestyle as the main driver. So why is everyone in a rush? Well, of course, our modern Americans want the quick fix, so providers and payers need to establish that standard of care here. Tell us how they are going to be used. What is the way to do this right? And they must do it now. We do not stray away from our order: safety, outcomes, cost. And ironically, if you do 1 and 2, then you get 3. 4, diverse support methods are essential. We firmly believe in a diverse support calendar that includes intensive one-on-one support at times, some laid-back one-on-one support at times to prevent burnout and let you stand on your own 2 feet, and some group support at times. That drives the best results because we are not alone on this journey. Throughout this structure, there is micro-content delivered throughout each week that keeps lifestyle at the top of the mind. And then weekly you talk to your coach. That is what we need to develop new habits every single week. 5, obey the FDA. They tell us that these should be used with diet and lifestyle modification. Now, I have seen hospital weight loss programs. For someone who is struggling with obesity, there are a multitude of mental and physical factors at play here. So how does a program think it is sufficient to have 4 calls with a dietitian, set a meal plan in place? Now, I'm not downplaying that, but these programs are months long and we eat 3 times a day every single day. Diet and lifestyle modification needs real support to get the outcomes. It's not going to work without it. 6, obesity is a root cause, not the other way around. Literally, many of the other top health costs on your claims list, on an employer's claims list, in the past, it has been viewed that they cause obesity. No more. It has now been exposed that obesity is causing these. So let's get to the root cause. I mean, cardiovascular, MSK, diabetes, fatty liver, what else do you want a positive study in? It's going to get approved for all of these indications on your health plans, in your insurance policies, because obesity is the driver. It's just a matter of time. And 7, do not fear the GLP-1 cost, as long as you require the right lifestyle program with it. One that isn't part of your wellness offering, that's different, but a required piece of your medical weight loss program. Now remember, it was the FDA that said this is how they should be administered. And you have a fiduciary duty to prioritize safety. And when you prioritize safety, you get better outcomes. And when you get better outcomes, you get the cost. Our program is a lifestyle project that utilizes a tool to silence the unhealthy environment around us for a short period of time, while we build our fortress of healthy habits. Then we are protected. And whoever is paying for the medication used it short term and now can save on those costs. So let's look at how our structure might shake out on costs. You remember this chart from before on our program structure. And while this is not a recommendation, this could be your company's average over time as your employees start to utilize the medication in the program. Now let's look at the high cost user of this medication, the red line. With or without a lifestyle program, you can see what it's doing. It ramps up fast, stays on longer, and not even sure if they can come off, right? They're dependent on it at that point. Then we look at the other, almost extreme, the turquoise line, and you can see that waiting longer. You wait longer before you go on it because you're feeling better. Then you want to try it, so you do it with a lower dose, and then you come off of it. You use it for a short window. This is ideal. And of course, the biggest opposite extreme is enrolling in the program and feeling better and not even moving on to medications. We have that happen. Enormous savings. Now let's look at some numbers. You can see associated with the red line. The red column here is showing the slow ramp then you're getting up to your max dose, kind of in that area, and then you're dependent on the medication. We do not want that. You have the gray line. That was our ideal situation, or maybe not ideal, but that was maybe our average over all the employees that are going to use it. Look at the savings. You're cutting it more than in half, just on the average of what it's probably going to look like in terms of Tara, because we are not dependent on the medication. We're always planning on coming off the medication. And you go to the ideal one, which is the turquoise line. Look at that. Another couple months waiting. We use it for a short period of time on a lower dose, and then you're not dependent on it. You can see that just one small switch, there's almost more than half the percentage of savings. And then when you jump to the turquoise line, look at that. It drops so much. The ROI is there as long as you have the right program in place. So to summarize, you can come to Tara Health Coaching for cash pay combo therapy, and we connect you with our partner doc in your state for medication management while we work on the lifestyle piece of the program. Or you can get these medications through your employer if they are approved. Employers, yes, you should start covering these medications, but only as part of a required combo therapy program medically managed for weight loss. I've never seen a situation like this with such high stakes where you actually benefit from doing the right thing. You get better results, you get results that last, and you do it at a lower cost. I would sign up for that any day of the week. All we just have to do is change our approach to it. So remember, we do not sway off of our order at Tara. Safety, outcomes, then cost. But isn't it funny that if you do it backwards with us, you get the same result? Cost, you save money with us out of the gate by having a plan on how and when you get the medications. And those requirements are built in. Outcomes in the combo therapy, if the medication is even needed, will achieve optimal results with lifestyle, right? Working in that short-term window. And then lifestyle leads. And when you do all that, it's safe. That's how you know you got the right program. So whether you are a physician that is interested in providing this structure to patients, an individual that is looking for the right weight loss journey, or employers and benefit admins that want to cover this for their employees the right way. This is the most important health plan decision in decades, and can also be the most impactful if you structure it right. So there you have it. Tara's 7 universal laws for GLP-1 medications. So let's talk and do this right.